second. So I'm just loading us up on Instagram. It's live. Next. Okay, we're live. We are live. Good evening, everybody, and welcome to the SASS webinar. Before we introduce our guests, I think for those who've been here before know that each one of our webinars are sponsored. And this evening, we'd like to thank Coloplast for sponsoring this webinar. Where we're going to speak diet, and I know diet often brings around very scary thoughts. Oh, I've got to cut out carbs and the like. And I think we need to kind of look at rephrasing that and maybe talk about nutrition guidelines or nutritional guidelines. And we have our very own dietitian or nutritional coach, Thandeka, who's joining us all the way from chilly Port Elizabeth. And then from Coloplast, we also welcome Amelia Voigt, who's going to be speaking to us about this little philosophy they have called ARC. I'm not going to go too much into that. I'll leave it to Amelia later on. But ladies, welcome and thank you so much for joining us this evening.
Thank you.
Thank you, Faisal.
So without further ado, we are live on Facebook, YouTube, and Instagram. And at a later stage, we will be uploading the recording onto our LinkedIn channel. And we're also going to be creating snippets for everybody, for those of you who missed it. But yes, let's welcome to the stage Thandeka, and who's going to be talking to us about nutrition. Thandeka, the floor is yours.
Thank you, Faisal, and everyone tuning in. Good evening. As introduced, I'm Thandeka. So I'm based in PE, now known as Gqeberha, at Livingston Tertiary Hospital. So yeah, like Faisal have said, I think when most people think diet, when most people think dietitian, they think about dieting. So within our spaces, we do not promote dieting, but we promote good nutrition and dietary habits. So it's supposed to be a lifestyle. So we do not make people diet because that's something different and it's not sustainable. So this evening we'll be focusing on nutrition and ostomies. So let's change the word from diet to nutrition. Next slide, please. For tonight, we are going to cover, obviously, most of us know now what is ostomies, what are stomas, but just for a refresher, we are just going to cover that, look at the effect of nutrition, common nutritional problems, and then we are going to look specifically between the three ostomies that we have. Then at the end, we're going to wrap up with our dietary practices, then we'll cover questions and comments. Next slide. As most do know, I think amongst the ostomates, they've had ostomy, they've had a stoma, health professionals are aware, but just to highlight what is an ostomy, also known as a stoma, it is a surgically created opening where you pull the bowel, which is your intestines, from the inside of the body to make an outlet outside the body. So this is surgically done. The indications are different. Some people who might have experienced trauma. Some people have chronic diseases such as cancer, Crohn's disease, diverticulitis. So the indication to have a stoma will be different amongst people. then the stomas can be created to be a permanent one, which it's something that you will live long life with. Then, or it can be temporal, meaning that it can be later reversed. Then obviously it's closed and your intestines are sutured back as they should normally be. Then we've got 3 types of stomas. So we've got our colostomy, our ileostomy, and our urostomy. So where they are done or performed, two people can have a colostomy, but the location and what you call, obviously because of the duration and the indication for having a stomy will then be different. 2 people can also have an ileostomy, but the sites where they are done can be different. So, but we are going to cover that in terms of nutritional implications. Next slide, please. Looking at nutrition, like we said, the aim for nutrition is to practice healthy lifestyle. It's not about dieting, it's not about cutting certain foods. Most people assume that you need to have a special diet for this, but it's not the case. So you just need to have a healthy dietary practice. And obviously, for people who have surgery planned for them, there is no way of knowing beforehand to say what type of eating problems you experience and what type of eating problems you won't experience after surgery. So whatever it's basically a new thing, trial and error. So one recommendation for one person will not be applicable to another because we are different. Obviously, looking at the age and why you needed a stoma and how long the stoma are you going to have it. But as everyone who's got a stoma, we just need to all have good healthy choices in terms of feeding so that you maintain a good nutrition and avoid as much as possible side effects. Next slide, please. So what are the common nutritional problems? So this generally with the 3 stomas, but mostly focusing on the ileostomy and the colostomy, these are the most common nutritional problems that people might have, which is nausea and vomiting, diarrhea, blockage, bloating and flatulence, constipation, odor, which is mostly common with the urostomy. When coming to nausea and vomiting, most of the people have this experience because they avoid eating. So when you don't eat, your body then reacts by having nausea, meaning that you get a production of acid, which can cause your nausea. Some people, because they've eaten a lot at a time, then they can experience vomiting. So we'll cover in terms of dietary practices what we can eat. Then we're looking at diarrhea, which is very common, especially because now the body has gone through changes. They've gone through surgery or the trauma of having that stoma. So the gut might be altered and then you experience diarrhea. So diarrhea, it's what you call loose stools, which are frequent. Obviously, when you've got a pouch inserted, it's easily to measure your stool output, so you can easily be able to determine if I'm having diarrhea or not having diarrhea. Because when you've got a pouch, everything gets collected onto the pouch, so it's not going to be like a normal person who goes to the toilet. Then obviously we expect you to have output. When you don't have output, that's when we start querying that, are you constipated or not constipated? So when looking at constipation, some people, if they don't eat, they will not have any stool output. So if I do not have adequate dietary intake, I'll have less output, then increases my chance of having constipation. So we need to determine, am I constipated because I am not eating? Or am I constipated because my stoma or my ostomy is not functioning as it should be? When we're looking at blockages, the food that we eat, which may be in bit sizes, not chewed properly, or maybe you might have food that have skins around it, especially your fruits and your vegetables, they might cause blockages. Your seeds and nuts as well, if you don't chew them properly, your popcorn, they can easily cause blockages, meaning that the food gets stuck into your stomach, then obviously you are unable to pass any output. If you're unable to pass any stool output, therefore you also increases your chances of having nausea and vomiting. So meaning that whatever is supposed to go out now doesn't go out. it goes the reverse way, which is what we need to avoid. Then if you are blocked, some of us can experience bloating and flatulence because there is no movement. Air gets stuck into your intestines, so there is no way of you releasing that air. Then you become bloated and you experience flatulence. Faisal, I'm not sure I can hear some sounds, or it's just me having.
These back to, I think it may be your mic. Okay, it's gone now.
Okay. All right.
That's much better. Yeah.
Okay. So as indicated with constipation, if you don't eat, you are not going to have output. If you don't drink a lot of water as well, it might cause constipation. Looking at odor, there are foods that if we eat, they are going to increase the smell of our urine. Some of those could be your garlic. Most of us do even experience that without even having a stoma. You can have a strong scent of your urine. Your garlic can cause that, your onions, asparagus. So most people will have the side effect of that food substance in their urine. So one other thing that we need to be aware is that one food item can cause a what you call a side effect in one patient or one person, and it might not cause another what you call side effect in the other person. So hence we say the recommendations are not the one size fit all. It's a trial and error. For some people it works, for some people it does not work. Next slide, please. Okay, now we are going to focus on each and every stoma just to highlight what are the main concerns. From the picture there, as you can see, an ileostomy is mostly what you call performed on your small intestines, the last part of your small intestines, which is your ileum. So that is the last point of absorption. Some digestion does happen there, but not that much, but it's mostly your absorption. So if there's a stoma there, that means that the time for absorption is now reduced. And it also depends if did they remove, we've got a sphincter there. It's sort of like a door that controls the fluid from moving from the small intestines to the big intestines. So if whenever the surgery is performed and that door kind of what you call control to say, okay, now it's time to let the food move from the small intestine to the large intestine is not there. So it means that it will just flow, meaning that there is no control. So most of the patients have a high output initially, but it should decrease 6 to 8 weeks post surgery. And because of that, what you call that outlet that is not controlling the sphincter, most of our patients lose a lot of nutrients. So because of that, they lose a lot of fats, they lose a lot of bile acids, which help with the digestion and absorption of nutrients. And there's also issues of vitamin B12. Some people have to go for monthly shots for vitamin B12 because they have an ileostomy. Then there's also a greater loss of your sodium and potassium, which are very important electrolytes in terms of hydration. If you lose a lot of those, you chances going to have dehydration because they control our fluid balance. And like I've said, initially your output might be higher, but as your stoma matures, your output should be decreasing. So an expected of 1.2 liters a day if you've got an ileostomy. Some people do have less than that, which could be 600 and 800 mils of output. It depends also on your dietary practices. It depends on other factors like, are you physically active? Do you consume alcohol? Is any other medication that you're consuming? Are you smoking? Which is one of the things that smoking and alcohol consumption we need to try and limit or avoid entirely. So foods that may not be tolerated with an ileostomy, it's food that increase the movement of the what you call the contents of the bowel, which could be caffeine. Hence we say reduce coffee, the smoking as well. It can increase the movement of your contents from the small intestines into your pouch. Then you are at chance of losing your electrolytes and your nutrients. So we also do encourage to say, if you are a coffee lover, try to reduce your intake. It's very difficult once people are so used to drinking coffee, as well as your energy drinks. Rather opt for tea if you can, or opt for sports drinks. There's a difference between sports drinks, which is your, I'm not sure if I'm allowed to mention names and
Go for
brands.
it. Go for it.
Okay, so our sports drinks, it's your Powerade, your Energade, your Aquela, Viv. Those ones have electrolytes, so people can drink that. Then your caffeinated drinks, which is your energy drinks, your Dragon, your Scores, your Red Bulls, very caffeinated, they are going to increase the movement of your bowel. So they will increase you having diarrhea. Then other foods that are not tolerated with the stomach, it's your gas-forming foods. Mostly the culprits are your cabbage and your beans. Those can easily cause gas as well. So your foods that are high in fiber, meaning that your fruits and vegetables, if they've got a skin around them, which is we also know as roughage, they can cause gases as well. Then we can also have abnormal stool color, because that's where the body is absorbing the nutrients. Sometimes when you eat something, for example, beetroot, it will show in your stool output. So most people are like, okay, what's happening now? But whatever you eat that has an overly expressed food color, it will show. Your foods that are high in colorant, it will show. Most people that also say, okay, when I drink coffee or when I drink something that has chocolate in it, I will see it through the color of my stoma output. So those are the things that people need to be aware of when it comes to ileostomy. Next slide, please.
Sorry, before we go to the next slide, you are busy with the ileostomy. Busisiwe has a question. Does having an ileostomy increase the appetite?
Increase what? Sorry.
Increase appetite.
So appetite usually it's just the body to show that, okay, you have a low intake, you need to increase your intake. So it won't necessarily cause you to have appetite. Some people naturally have a good appetite. Some people naturally don't have a good appetite. But appetite being increased or suppressed is just a way of the body of reacting to show that, okay, if I'm suppressed, if I'm suppressed, I've got suppressed appetite, it might be a sign to say maybe I'm getting flu, or I'm mostly when people are sick, we know that, okay, they've got decreased appetite. But when we look at the opposite, people who are more active, they've got increased appetite because they are mostly active, they use a lot of energy. So the body will indicate to say, you need to eat to keep up with that, what you call energy use. But it's not necessary that having an ileostomy will increase your appetite. Having a good appetite is not a bad thing. It's actually a good thing. We need you to have a good appetite so that you can eat as much as you need. But obviously, she needs to be aware of what she eats. If you've got a good appetite, avoid your takeaways, avoid your fried foods, avoid your salty foods, your sugary foods. Go for the healthy options. Because obviously, if I've got a good appetite and I'm eating inappropriately, I'm going to gain weight. I invite conditions such as high blood pressure, diabetes, also cancers can be also a high risk for that. So it's actually good to have a good appetite. It's not a bad thing.
Awesome. Thank you. I hope that answers you, Bilsi.
Okay, looking at the colostomy it's done at the large intestines. After the small intestines, everything will pass the absorption phase. Mostly what happens in the large intestine is the absorption of water and electrolytes. Not much nutrients are absorbed there. There is minimum, but not as much as the ileostomy. So what most colostomy patients experience, it's dehydration and low electrolytes. Not necessarily like the ileostomy where you'll have vitamin deficiencies. So, but they need to be aware to say that they still need to practice healthy eating. So when you've got an ileostomy, now we've got a reduced time for water and electrolytes absorption. It also depends where it is. So if you can have a close look at the picture, there's different points where the ileostomy be. It can be on your left, right, at the top, closer to the anus. So it can be anywhere depending on the indication, obviously, from the surgeon to say where does it need to be. So, but what most of the people present with is what you call dehydration and electrolyte imbalance. So when you compare the stool output of the ileostomy and the colostomy, so the ileostomy will always be watery compared to the colostomy, which is more formed. Basically, it's towards the end of your digestive system. So you expect to have a more formed, softer compared to a more runny than the ileostomy. Then the output, obviously, it's going to be less. Some people might have between 200 and 600 mils. As I've indicated, that it's towards the end of the GIT. So that's where mostly the absorption and excretion is, what you call the excretion is about to happen. So what foods may not be tolerated with the colostomy? Foods that can easily cause loose stools or diarrhea. So in this case, if a patient or individual is going to have more than 600 mils of output, therefore you need to query, am I having diarrhea, and how much you empty your pouch. Remember, on average, a person needs to go 2 or 3 times to the loo to do number 2. So compared to that, yes, the physiology won't be the same, functioning of the body won't be the same as to a person who's got a pouch and a person who doesn't have a pouch. But if you are going to frequently what you call change or empty your pouch, it will indicate to say, no, I'm now experiencing diarrhea. And obviously, if it's harder now, you have a risk of constipation. If I have not passed any output for a day, then you need to say, okay, I need to do something. And then your gas-forming foods and your odor-causing foods, as indicated previously, your gas-forming food could be your cabbage, your beans, your broccoli, your cauliflower. Your odor-causing foods will be your asparagus, your onions and garlics are mostly the biggest culprits in that. Then also your urinary color will change because that's where the body absorbs the water. If then obviously your urine is darker in color, it could indicate that you are dehydrated. If it's lighter in color, that means you are well dehydrated. How much do you need to determine if I am dehydrated or not dehydrated? Obviously, each and every person, the urine output is not the same. Some people are frequent uriners, some people are not frequent uriners. If you are pregnant, your frequency to go to the urine is more than of someone who's not what you call pregnant. Some people are on medication. It can cause you to go visit the toilet more frequently than the other. Some people have conditions like diabetes. They go to the toilet a lot. But every time you go to the urine, you just need to check, to the toilet, you need to check the color of the urine. It's something that we need to make it a norm to say, when I go to the toilet, I must check the color. I must check behind me. If I'm going to empty my pouch, I must check the consistency. I must check the color, how it looks. So if it's dark urine, meaning that you are dehydrated, light urine, it means that you are well hydrated. As well as the abnormal color stool, which is mostly your food colorants, your beetroots and all that. If it's bloody or it is greenish, that's when you need to start querying. You're not supposed to have bloody stools. You're not supposed to have green colored stools. It needs to be normal brownish. We all know my brown color stools and the next person's brown color stools will not be the same. So you need to know what's normal for you and what's not normal. But the moment it's bloody stained, meaning that you see some blood there, or you see it's green coloring and it's changing, or it's black, then it should be a concern. Because black might show that it's old blood. When it's bloody red and fresh, it means that there is new blood, meaning that there is somewhere where you are having a bleed. Then if it's green, that means there's also an issue in terms of your digestion and absorption. So we need to be able to check. Then obviously, if it's the colors that are not good, then obviously you would need to have to consult your nurse or your doctor or whoever is close by to you. Next slide, please. Okay, the difference between your ileostomy and your colostomy versus your urostomy, it's that the 2 previous stomas are actually directly into your GIT, meaning your gut, your gastrointestinal tract. Then the urostomy, it's within your urinary system. So it's 2 different systems. So your urostomies, most of them don't have any digestion and absorption issue or excretion. It's just mostly through the effects of urine to say what's the urine output, the amount, the color, and the consistency. We know that urine should just be the consistency of water, just yellow, because obviously the body goes through digestion and absorption and all that. It shows that it's excreting those toxins or the waste products that the body has to release. Like I indicated, if it's dark, it shows that there's issues. If it's light, we are fine, well hydrated. Similarly to the stool output, your urine should not have blood in it. It should not be green. It should not be black. You should have light yellow as possible. Doesn't mean when it's clear. We do have people who experience clear urine, obviously after mostly when they've drank water, which is it's normal, but it should not always be clear. But light to clear is what we need, and it should be the consistency of water like indicated. If it's different now, it's having mucus or it's thicker, then we should be worried. You would need to have to get a checkup. So foods that would cause as well as odor, we need to be aware of that. When people eat fish, some people, when they eat tin fish versus fresh fish, the reaction is not the same. Most people would complain of the tin fish because obviously it's preserved for a long time. It has that strong scent and odor versus fresh fish, which is from the sea or maybe from the fish market, which has little odor or a scent, which is not as strong. Eggs as well. Some people would say which we all experience obviously with boiled eggs, you have a strong smell as well with that, as well as your fluctuants will always also be stronger versus when someone has fried eggs or poached eggs. Then your asparagus as well, your green beans and your cabbage family vegetables, your spinach, your broccoli, your cabbage, your lettuce, people can experience a urine odor with that as well. What can we do to prevent that odor? Cranberry juice is one of the good what you call foods that we can eat. Your yogurt, which is good, keeps your gut healthy, keeps your urinary tract healthy from the prebiotics. The good bacteria in the yogurt clears and definitely gives that good scent to the urine, as well as amasi or buttermilk, either of the two. But I know most of our population consume amasi more than buttermilk. That's also an option that they can go for, obviously, and which should have been at the top. It's your fluid intake, our water. We need to drink a lot of water. Let's avoid our sugary drinks, our Cokes, our energy drinks, our juice cordials. So we need to limit those because they contain a lot of sugar and we shouldn't be eating or consuming a lot of sugar. So our fluid intake is very important. Most people will ask cold or warm water. It's not a problem, either or, whatever you prefer. Some people prefer warm water with lemon. That's also a good one. Some people just prefer cold water from the fridge, or some people like with extra ice to make it colder. It's not a problem. The temperature won't have much effect on that, but we just need to promote clean water. Tap water. Previously we were lucky as a country. Most of us had clean tap water, but now we know there are areas where people are struggling. Then if they've got issues with water, they can boil their water, or they can add bleach to 25 mils of water, 1 teaspoon in 25 mils. They can filter their water. They can boil, let it cool down, and keep it home. I know now there are sachets for sterilizing water that they sell in pharmacies and our retail shops. They can also use that just to add to the water to make sure that it's clean and sterile. So those who are able, obviously, to go and buy the refillable water, they are more than welcome to do that. But what is important is for us to drink water. Then obviously those who like hot beverages, hot chocolate will be fine, but it does not replace water. Our teas, which are good, would be your rooibos tea, your black tea. The less caffeine it contains, the better. The more caffeine it contains, not good, because caffeine also increases urine output. So you lose a lot of water with high caffeine consumption. So you need to limit caffeine. So you can keep to your black tea, your rooibos, hot chocolates, caffeine free, Then obviously your coffee. What I always recommend with patients, if you're going to have a cup of coffee, drink a cup of water so that you just balance. I know you want the caffeine kick, but we still need to be dehydrated. Next slide, please. So as we are going to sum up, just to summarize everything as indicated, we do not have to have a special diet. It's a trial and error for everyone. Some people, a certain food group will work. For some people, it won't work. But there are things that we all need to keep to, which will all help us to avoid our common, complications. So as indicated, drink a lot of water, 8 to 5 cups a day to avoid dehydration. Drinking this does not mean that you have to drink all the cups at a time. So this is an average of 2 liters a day. We now have these nice fancy bottles that people carry around, which is a good practice. Carry your own water wherever you go. You can have the nice labeled bottles that have times to help you to drink. They've got nice motivational messages. It's nice to have that. Or you can just keep your own, depending on where you're going, how much baggage you can carry around with you. Just keep something that it will be easy for you to measure with, and something that you will be able to keep track of. So, but 8 to 10 cups a day will be what we need to prevent dehydration, not only dehydration, also to prevent constipation. Then whenever we are eating, we need to eat slowly and chew our food thoroughly. I know most of us eat on the go. We are on the rush. We are going somewhere, but let's make it a habit to sit down, eat slowly, especially in the early days of our ostomies, because the output is very high there. If you're always going to be in a rush, you're not going to take your time when chewing your food, you're going to experience a lot of complications. Also, sitting down and sitting up when eating and after eating, let's not eat and sleep, which also causes the nausea and vomiting. So you must always be at an upright position so that you can be able to chew, take your time, not in a rush, which also helps you to avoid those complications. Also, eat smaller, frequent meals instead of large meals. So we've got breakfast, lunch, and supper. Try to keep to those times. Then you have snacks in between. You can have after breakfast, 2 hours later, you can have a snack. A snack is just a small light meal. Can be a fruit, can be a snack. A packet of nuts can be a snack. A packet of popcorn can be a snack, obviously, depending when you can now eat those certain food groups. So there's 8 weeks after surgery and 8 weeks when obviously it's past the matured stage where now you are tolerating food. Then you can easily maneuver and try new things. But the 6 to 8 weeks right after surgery, that's the most critical time when people can easily have complications. Then, as indicated, your snacks, have them in between your meals, and also try to eat at similar times every day. If your breakfast is at 7, make it at the same time or around the same time. Doesn't mean that you need to be strictly at 7, but we know some of us are busy. You might be stuck in traffic. Then when you get to wherever you're getting now, you can have your meal. But try to schedule your meals around the same time. Then have your biggest meal during the day. This will help you to avoid a large output at night, because when we are sleeping at night, your body relaxes, then your gut also relaxes. It's easy for it to have a high output just from sleeping, because you are relaxed now, you are not thinking, you're not busy, the body is in a resting state, so it's easy for you to have a high output. But if you can have your large meal, make it your lunchtime meal to be your large meal, then you will avoid that, because you'll have enough time to digest and your body to absorb, so that you don't have a high output when you're sleeping at night. Then, as indicated, alcoholic and caffeinated beverages, as well as smoking, we need to avoid that. Some of us, yes, we've been chronic smokers or consuming caffeine for a long time. It's a gradual process. It's not a one-day thing to say today I'm stopping. Yes, some people are really good. It can happen, but it's a process. Then let's be active as possible. Physical activity also helps the body to adapt, helps the body to control the flow of your what you call your gut contents. Whatever is in your stomach can easily be controlled just through physical activity. And it also helps us to control our body weights, because the more you gain weight, most of these what you call complications are easily to have, because you've got a high BMI, which is what we use to assess our weight status. We use the BMI. Then, as well as one other thing is keep a journal, so that you can able to track.
Sorry, Thandeka, just you speaking about being active. Lorato posted a question here asking, does living an active lifestyle increase bowel movement?
Initially, when you start being active, your body will react, and the way it will react, obviously, it's an output. So there's ways of you working through. If you want to go to the gym, if you want to have a 5K run, are you going for a marathon? There are ways that we can help you to adapt or to space your meals around that. Obviously, when you're starting, because now this is something new, your body is actually in shock. What's happening? And the output will show that, okay, I've introduced or reintroduced something new to this condition. So the body will react, but eventually your body adapts. So in the beginning, it might have a high output. Then towards the end, it can normalize and stabilize. Then, like I say, we can work around what time are you going to gym? When are you going for a run? Obviously, even me as a normal person without an ostomy, I am not going to eat before I go to the gym. I'm not going to eat before I go for my 5K run. So there's ways of working around that. So some people do have a high output, but it being physical activity, being physically active will at the end of it be a good effect to the stoma and yourself as a person. Like we said, it helps you maintain your body weight, which is very also important to avoid a lot of complications for our ostomy patients. Then, as I was saying, you can also keep a journal. Luckily now we can have notes on our phones. Just write things that you think it's odd. Today I experienced this, and there are patients or individuals who are very good. So it will also help you to track back to say, okay, on this day, this is what I did. I introduced this or I ate this. Now I've got this side effect. So if you can just keep a journal, some people are really good with keeping food journals, but we're not saying be overly obsessed with it, but you can note down the things that you feel like, okay, today this is something new, you note it down. Then one other important thing is our food handling and hand washing. Mixing raw food with cooked food is not ideal. Hand washing is at all times. Before you eat, your eating utensils, when you go to the bathroom, when you're doing a pouch change, it's very important to wash your hands at all times. That's generally for everyone. Whether you are having a medical condition or not medical condition, we need to practice good food handling and hand washing practices. Next slide, please. Oh, so yeah, we are at the end.
So we have a few more questions here. So Lorato again asked, and she says, "Hi Thandeka, we are seeing more and more people not having access to pouches. This may come as a stupid question, but but very real to others who we come across. If ostomates eat less because they're not getting access to their pouches, you automatically think eating less will mean I have less of an output or will pull less. Is there truth to this?"
Yes, there is truth to that. Because you are eating less, there is nothing for the body to digest, absorb, and excrete. So this is an unfortunate experience that our patients are having to go through, which is not even, when you look at the principles of ethics, it's an infringement on all those principles. So we should not even find ourselves in that cases. It's not ideal. So yes, I think that's one of the chats that we have previously in our our CPD session to advocate for all our patients to have access,
To these pouches.
to these pouches, so that they do not reduce their intake. Because obviously, if I don't eat, some people can go as much as the whole day fasting just because they don't want to have an output, because they don't have the pouches, which is not a good thing, meaning that we are also indirectly infringing on the right to nutrition and food. So basically, the health of the person is affected, the nutrition of the person now is affected. So it's a double effect. Not only that the person is not going to have access, they don't have access to the pouch, they also having an effect on their nutrition, because if I don't eat, first day I don't eat, second day I don't eat, third day, what's going to happen? I'm at risk of malnutrition. I might have deficiencies. Now I might have this complications. I might have nausea because I'm not eating. The body will react. I'm not eating. I might have constipation because I'm not eating. I might be dehydrated because I'm not eating. So what then happens? The next thing, the person lands up in the emergency.
Yeah.
Then we have
It creates additional problems.
yes. So it's true. Is it Lerato?
Lerato, yes.
Yes. So it's not something that we say people must do it. We do not encourage that, not at all. It's unfortunate that people have to do that.
Thank you. Thank you for that. And then there's one more question. Can those with colostomies experiencing constipation use laxatives? And if so, how often?
We do not promote the use of laxative with or without an ostomy, because it changes the way the body should be able to function. Yes, we obviously, when the person has chronic severe constipation, we need to relieve the person. So we say they can have laxatives, but it's only when the person has been assessed and checked to say you can have laxative, but it's not for long-term use, because laxative have an effect as well. The body will not be able to have that control, because when there's laxative, it means that the gut is relaxed. So meaning that everything just flows as it should be. Then the gut, we say it loses its function. So it's not ideal to use laxatives at all times. Make it a habit. It should not be. Same with us as health professionals. We only use it when there is a reason. You've tested, you've tried this, it doesn't work. Or obviously the person is, like I said, severely constipated. You need to relieve that, because obviously if you can't keep on doing tests when this person is complaining of constipation, it's painful, they've got bloating, they've got flatulence, which is severe. So, but we do not promote the use of laxatives. There are foods that we can use to soften your stools. Your bananas can help you soften your stools. Your pasta, your rice, your breads can help you to soften your stools. So have those foods instead of what you call your laxatives. You can have your peeled vegetables and fruits, your apples. You can have your dried apples. You can have your dried pears. They are soft and they can help you to release. Obviously, if you're constipated, one other thing that you can use is prune juice. But once you have relieved yourself, don't make it a habit to say, I'm going to use prune juice or I'm going to consume the prunes. So, yeah, no to laxatives. It should not be a habit.
So then just to add on to that, if I may, what is the difference between a blockage and constipation then?
Okay, constipation, there is no output. Blockages, there is output, but it cannot pass. You cannot pass it out. Constipation, it can either be that there's nothing to pass out as well. There can be what you call output. Sometimes it can be hard to pass out, but with blockage, it's not going to be hard. It's just that the outlet, the small outlet that needs to release to the outside, is blocked.
So nothing will get through.
Nothing will get through. Sometimes it can be confused because yes, there's no output to the outside. But sometimes constipation, I can have output, but it's hard. If it's hard, then you are constipated, and the amount as well can be minimal. Hard, it's constipated. Then the blockage, I want to pass, but because that outlet is just blocked, I can't pass it out. Sure. Then if either or the two, then some of the people can now experience vomiting because there's nothing to pass out. to pass out, yes, with constipation or to pass through with blockages, then it goes the opposite direction. And we also need to avoid that. We don't want you guys to be vomiting up. It's not a normal, what you call, thing to have to experience. It's not supposed to be like that.
Thank you. Thank you so much. And thank you to everybody for the questions. It doesn't look like there is any more. Thandeka, we thank you for your time. Thank you for the presentation. We are now going to hand over to Amelia, who is going to be speaking to us about ARC.
Thank you, Faisal. And yeah, thank you for this opportunity. I'm the Ostomy Care Market Manager at Coloplast, so it's an absolute privilege to represent Coloplast and to introduce the initiative ARC to everyone. This might not be that new to everyone on the call, but I sincerely hope that the initiative or the concept will be able to inspire those new to ostomy care, and that it can help and support you on your journey living with a stoma. So we'll kick off my session with a short video, and Faisal, I will hand that over to you to play for us, please.
Thank you.
Prevent leakage and establishing appropriate change routines. Apply, remove, check. Help do just that. First up, apply. Proper application can ensure the skin is protected from stoma output and the skin complication it may cause. Always make sure the base plate is applied to clean and completely dry skin. Cut the hole to fit the size and shape of the stoma. The key is to make sure the base plate has a snug fit, not too loose and not too tight. If it is challenging to get a snug fit, it may be beneficial to use a supporting product, such as a seal. Remember, the stoma can change size and shape over time, so to check it regularly. If the skin is moist or needs extra preparation, supporting products such as powder or protective spray may also help. Next up, remove. A gentle removal technique will help to protect the skin around the stoma. Pull down the removal tab to loosen the adhesive from the skin. Gently remove the adhesive by rolling it step by step downwards, while applying light pressure on the abdomen with the other hand. An adhesive remover can provide a little extra help. Finally, check. Checking the skin and the adhesive can reveal if the change routine is appropriate. Check if the adhesive or if there's any stoma output on it. Then, check the skin around the stoma for signs of redness or damage. Using a mirror can be helpful. Healthy skin around the stoma should look the same as the rest of the abdomen. If there is a feeling of discomfort, itching or burning under the base plate, it is important to change it. Routine is. If there are signs such as erosion of the adhesive plate, leakage on the base plate or the skin, irritated or discolored skin, it may indicate that the product should be changed more often. Life is more comfortable with the right change routine.
Okay, thank you, Faisal. And then we can switch over to the presentation. Okay, everyone. So what is ARC? I think the video gave us good insight. ARC is not Noah's Ark, but this is an ostomy ARC that will basically help people living with a stoma. So it's an educational initiative that's developed by Coloplast. And it helps to promote and establish a good appliance change routine. So why do we need a good appliance change routine? Because we all know that leakage is a huge concern and a problem for people living with a stoma. So we want to establish a routine and help you establish a routine that can minimize the risk of leakage and associated skin problems and break that cycle, that vicious cycle of leakage and skin complications. Next slide, please. Faisal, thank you. So it consists out of 3 easy steps. So it's easy to remember and to follow. So A, obviously, for when we look at ARC, so A refers to apply, R refers to remove, and C refers to check. And each step is equally important in order to protect the skin around the stoma, which is called the peristomal skin, and to maintain a healthy peristomal skin. I think that is so important, that we preserve the skin, and everything we do, we try to protect the skin to make sure that we do not suffer from leakage and skin complications. So apply refers specifically to how you correctly apply your product, your base plate, together with your supporting products, so that your skin is properly protected from the stoma output and the irritation that the stoma output may cause on your skin. Looking to remove, the next step in the process, this refers to how you will correctly remove or what is your correct removal technique. Meaning that we don't just rip off the base plate from our skin, but we want to apply a gentle a technique to, again, minimize the risk of mechanical trauma to your skin and prevent skin stripping. And then lastly, check refers to checking the actual adhesive, the back side of your base plate, as well as your skin, in order to see if you are applying a good appliance change routine and if that routine is adequate, and also to investigate if there are signs of stoma output or an eroded adhesive, or the skin is irritated. And that might then require you to either investigate the need to adapt your routine, change the appliance more often, or use another type of appliance or supporting products. But let's deep dive into this a little bit more. Thank you, Faisal. Next slide. So let's just look at application. So it's really important in order for you to secure your adhesive, your base plate, to your skin, the skin around your stoma needs to be clean and completely dry. And we recommend you avoid oil-based solutions or soaps or lubricants, because that's going to prevent your adhesive from adhering to your skin. So just normal clean water to clean the skin around your skin is sufficient, and make sure that the skin that your skin is dry before you apply the adhesive. Otherwise, it's not going to stick. Also, what's really important is that the whole of the base plate or the flange or the adhesive should be cut according to the size and the shape of your stoma. So exactly, so that you get a snug fit. And that's important because your stoma can change in shape and size as you gain weight or lose weight. And your stoma is certainly not going to be the same size from post-surgery to, say, a year or a few years after surgery. So we need to make sure that the hole is not cut too large, and it's also not cut too small, but that you size the size of your stoma, and you cut according to that size as well as the shape, because not all stomas are round. Some are oval shaped, different types of shapes, different types of stomas. Everyone's stoma is different, so you need to adapt according to your specific need. And then the use of supporting products, such as paste or seals or barrier sprays, wipes, elastic tapes, can be super helpful for patients who do suffer with difficulties or some irregularities around the stoma. It might be deep folds or superficial creases, etc., that can contribute to leakage and skin complications. So by using supporting products, they may prevent leakage and protect your skin, and just allow more freedom and a better quality of life compared to not using them if they are indicated to be used. Next slide, please. And as I mentioned, over time, your stoma changes in the shape and its sizes, so that it means that you need to adjust according, or your template accordingly, due to the fact that over time we either gain weight or lose weight, etc. But the size that you were the start with will not necessarily be the size that you are going to cut your base plate when you are 5 or 10 years within your journey of living with a stoma. So for optimal application, you should check the size of your stoma periodically. And that is all about application. So let's look at removal. Next slide, please, Faisal. Thank you. All right, so when we look at the technique in removing your base plate, and to help prevent skin irritation, it's really important that we remove the base plate or the appliance gently. We often see ostomates being impatient and just ripping off the base plate. And when you do that, it really can cause some mechanical trauma and skin stripping. So either regular appliance changes as well as gentle removal will definitely help minimize the stress to the skin around the stoma, together with the use of supporting products such as an adhesive remover will just enable the process to be a lot more gentle. And then when we look at your appliance change routine, you must always change your appliance. And this one is quite important. When you feel that there is itching or burning underneath your base plate, that is a sign of leakage. And it means that you need to remove your base plate and apply a new bag. And that's where the checking comes in as well. And we often see ostomates walking around with leakage and skin complications, thinking that that is normal. And it's absolutely not normal. So if there are any signs such as an itching or a burning sensation under your base plate, that means there might be a slight leak. And a slight leak is a leak that can cause complications. So we need to change our base plate should you experience those complications. Next slide, please. So let's move on to check. That's the third step in ARC. And I think, again, it's so important that we understand what is the difference between healthy skin and unhealthy skin. So whatever your skin color, the skin around your stoma should always look the same as the rest of the skin of your abdomen. And you'll see the image there on the slide. That's just an example of what healthy, intact skin should look like around your stoma. There's no redness, there's no irritation, there's no excoriation or breakdown of the skin. And that is perfect. There should be no visible difference or damage to the epidermis. So that is what we check. So we check if the skin is healthy or if there is some complications or skin irritation to the skin. Next slide, please. And thank you. So how do we check? So we check the skin, yes. And if there are any visible signs around your stoma, redness or damage. But we also check the backside of the adhesive. And you will be able to see if there's any erosion or the presence of stoma output. And you'll often see that there's a pattern that mirrors each other. So what you see on your skin will mirror what you see on your base plate. And that is an indication of that there's leakage. Next slide, please. So here again, the purpose of checking the adhesive and the peristomal skin after removal is so that you can be more proactive and prevent leakage with your next appliance or your product application. So examining the adhesive base plate and the skin area it's been covering will reveal if you have an appropriate appliance change routine, and or if you need to adjust to improve your peristomal skin health. And again, everyone's needs are different, and what works at the first stage of your journey is not necessarily what's going to work in the second or third or fourth stage of your journey. So if there are any visible signs of skin damage, or you see erosion on the adhesive, it may indicate that the appliance was not either applied properly, but it can also indicate that you need to change your appliance more frequently, or you need to adapt and change the type of appliance that you are using. It might mean that you have been using a flat base plate from discharge after surgery, but as your body has changed, the body profile has changed, you have gained weight or lost weight, it means that you probably would need a convex base plate, for instance. So as soon as you start experiencing leakage and skin complications, you have to immediately think to yourself, something is wrong, this is not correct, let's investigate, let's go back to my stoma nurse and make sure I'm using the correct product, and I'm using the correct supporting products that can help me to prevent leakage and skin complications. And here again on the images, we can see the difference. So the top two images with the red cross, clearly you can see the redness and irritation and skin damage around the stoma. And that mirrors on the base plate of the back side of the base plate. And you can see the erosion that is caused from the stoma output. That is not normal. So if you are experiencing that, we need to resolve that as soon as possible. And then below you can see what a healthy skin again and a healthy backside of the base plate looks like. Beautiful, intact skin, no redness, no stoma erosion or output on the base plate. So in summary, again, ARC, not Noah's Ark, but Stoma Arc, is an easy way to remember and apply a good or appropriate appliance change routine, from application to removal of your base plate and your appliance, and then checking for any visible signs of leakage and skin complications so that you can be proactive in your prevention approach and live a life to the fullest with living with a stoma. And that is the end of my presentation. Thank you very much. And yeah, I'm open for any questions.
Thank you so much, Amelia. We do have two questions. Lorato again. Lorato is very busy tonight. Thank you, Lorato. Lorato asks, please address the issue of small blood on the stoma. Even though the skin looks healthy, is this normal?
So I assume if there's spots of blood on the stoma itself?
Yeah.
Okay. So, I mean, that can be caused from some type of trauma to the stoma. If it's just one spot and there's no active bleeding, I wouldn't be too concerned about it. But if this is a continuous chronic problem, I would go back to my stoma nurse and just ask them to assess and see what is causing the bleeding in or around the stoma. But peristomal area, that is the skin around the stoma, if there's blood caused from damage of the skin, then there's a problem. So that means that there is a skin complication that needs to be addressed, and that can be either the cause of leakage or skin trauma. So again, rather go back to your stomal therapy nurse, go back to the stoma clinic for a reassessment to treat the skin around your stoma, and also to prevent continuous and frequent complications.
Thank you. I found, I think most often when I go run, was very active. A little bit of friction, it can cause a little bit of bleeding. Usually it only happens one time. If it does go for longer than that 1 or 2 times, see your nurse. Yeah. Then there's one. How do I know that I need to change to convexity?
Good question. So if there's leakage and you have been using a flat base plate, your body is changing. So it might be that you have an inward peristomal area. So there's a little dam around your stoma and you're using a flat base plate. Then a convex would be the most appropriate solution. It might be where the stoma is, the mouth of your stoma is not above your skin, but it's level with your skin, or it's pulled in and below your skin level. So that is 2 very clear indications that you would require the need of convexity. Also, if there are deep irregularities around your stoma, so if there's deep folds, it's a variable sort of form around your stoma, then and there's leakage, then I would consider the use of convexity. But again, you would need a trained stomal therapy nurse to do a proper assessment. And there are different steps that they would then assess, considerations that they would need to take in order to prescribe a convex base plate, because everyone's need is different. But normally convexity is prescribed according to those indications. Inward peristomal area, and when the stoma is either level or below the skin level. And then there's other factors that is also considered.
Thank you, Amelia. And then Capano. Capano says proactive in athletes, jogging. Now my interests are participating in football. Football is a contact sport. What are the disadvantages? If I can answer that one, I think Capano, the very first thing I would suggest is that you make sure you're in good physical condition to participate, especially have a strengthened core. This will help you to brace your abdominal area a lot better. Secondly, you do get protective cups, although a lot of people that I've spoken to stopped using those cups because they're all saying exactly the same thing. Our stomas are a lot tougher than what they look. In fact, there's a team in the UK. It's a rugby team. Every one of the players except one has got a stoma. The person who doesn't have a stoma, they've made him an honorary ostomate. And the only reason why he's playing in that team is because he is the team's bookkeeper. But, they all play full contact rugby. In Australia, there's a lady, I forget her name. She does mixed martial arts with a stoma. And then I know of a firefighter in the US who has a stoma. So don't be afraid of the contact. It's a lot tougher. But being in good physical condition can also help protect you. We have another one. I'm assuming that bags are imported. Is there a possibility of having them made locally?
Yeah, unfortunately, that is a question I can't answer. But from a Coloplast perspective, yes, our products are imported.
Thank you. I think that is the last of them. Ladies, I want to say thank you very much. We got some very nice comments that's come through. I'm from Kenya, and that was good to learn about nutrition and the pouching. We've also got, there was another one. Oops, I can't get to there now. We have Chabo, who says, thank you. That was a beautiful presentation. So
Thank you.
to both of you, I think, the biggest message out there is that people are learning, and that's why we're doing what we're doing here, trying to raise the profile and raise the awareness of ostomy care. The engagements this evening was really good. So thank you to all of those that's been watching. I think we've gone a little bit over time, and I don't want to hold our guests up for too much longer. So thank you very much, Thandeka and Amelia, for your time
You're
and
welcome.
sharing your knowledge with us. And hopefully we can have you back down the line to pick up the conversation and learn a little more. So thank you very much, everybody. Enjoy the rest of your evening.
Thank you, Faisal.
Thank you. Thanks, Faisal.